If you notice that you sneeze every time you step out into the bright lights, it's probably not your imagination. You may have a condition called ACHOO Syndrome or the Photic Sneeze Reflex. In today's video, we'll find out why you have it and what you can do to treat it. Let's get into it. The photic sneeze reflex is triggered by sudden bright lights, particularly sunlight, but it can also include artificial lights. Often you'll sneeze not just once, but multiple times, sometimes even up to 50 times in a row if you're unlucky. It's the sudden increase in light intensity that causes it, rather than just being around bright lights. For example, if you're outdoors on a sunny day, you may not experience it, but if you suddenly go outside into bright light, coming from a dark room, then it may trigger you to start sneezing. Now, the reason we get this sneezing reflex to bright lights is not quite understood, but there are two possible theories. The first theory is believed to be due to a crossover of signals in the brain. The trigeminal nerve, responsible for facial sensations and controlling sneezing, interacts with the optic nerve, which processes visual information. When someone is exposed to sudden bright lights, the optic nerve sends a signal to the brain. These signals can inadvertently trigger the trigeminal nerve, leading to the sneeze response in some people. Their second theory is the parasympathetic generalization hypothesis. When a stimulus excites one part of the parasympathetic nervous system, it activates other areas as well. In this case, bright lights leads to our pupils constricting, which may cause nasal secretions, which then causes sneezing. The photic sneeze reflex is inherited from the parents. If one parent has it, then there's a 50% chance of it passing on to the children. It's estimated that around 18 to 35% of the population experience this reflex, although this does vary amongst different populations. You have a higher chance of developing this reflex if you're female and Caucasian, have a deviated septum, or if you're a smoker. Sometimes during eye surgeries, an injection in or around the eyes can also cause this photic sneezing reflex, which can potentially be really dangerous with a needle sticking near your eye. If you're going in for eye surgery, make sure to let the doctor know if you suffer from the photic sneezing reflex. At this point in time, there is no cure. Antihistamines such as fexofenadine, cetirizine or loratadine may help, especially if you also suffer from hay fever or allergic rhinitis. You can do some things to help prevent it, such as wearing sunglasses, wearing hats, or shielding your eyes when you go out in the sun. A technique you can also try, which is very effective, is called the philtral pressure technique. This is when you apply pressure with your finger underneath your nose where the philtrum is. This is very effective in stopping the sneezing reflex. Now, there's a suggested link between those who suffer from the photic sneeze reflex and those who get migraines, as both involve the trigeminal nerve and parasympathetic systems. However, much more research into this area is needed. So that comes to the end of the video. If you found anything useful in this video, please consider subscribing. Thanks for watching, and I hope to see you next time. Bye!